Welcome back to the GMP and Quality Fundamentals series, and this is Lecture 21. In Lecture 19 we covered technical agreements. In Lecture 20 we covered COA review. Today we complete the supplier management picture with supplier qualification and auditing. Here is the principle that drives everything in this lecture. Your product is only as good as your weakest supplier. The API, the culture media, the primary packaging, the contract testing laboratory. If any of these fail, your product fails. And in GMP, you are responsible for that outcome regardless of where the failure happened. Supplier qualification and auditing are how you manage that responsibility before a failure occurs. Here is what we will cover today. Number 1, you will understand why supplier qualification is a GMP requirement and what the real-world consequences of not doing it are. Number 2, you will learn to classify suppliers by risk tier. Not every supplier needs the same depth of qualification, and understanding this saves significant resources. Number 3, you will master the 5-step qualification process from the initial questionnaire through to entry on your approved supplier list. Number 4, you will know how to plan and execute a supplier audit, and what specific areas to focus on during the visit. Number 5, you will understand ongoing monitoring, the triggers that require requalification, and exactly what inspectors check when they review your supplier qualification files. Let me start by grounding the importance of this topic in regulatory requirements and in real-world consequences. EU GMP Chapter 7 on Outsourced Activities and FDA 21 CFR 211.84 both require that raw materials and components are obtained from approved suppliers and that those suppliers are evaluated for their ability to consistently meet your specifications. This is not a best practice recommendation. It is a regulatory obligation. The real-world consequences of failing to qualify suppliers have been severe. In 2008, contaminated heparin manufactured in China caused serious adverse events and deaths in patients in the United States and Europe. The contamination was traced back to an uninspected, unqualified supplier in the supply chain. In 2018, NDMA contamination in SART and APIs affected patients across Europe and the US. Again, the root cause traced back to process changes at API manufacturers that were not notified to customers and were not detected because adequate supplier oversight was not in place. These events directly led to significantly tighter FDA and EMA expectations around supplier qualification and oversight. From an inspection perspective, supplier qualification files are reviewed in virtually every GMP inspection. Inspectors cross-reference your approved supplier list against your qualification records, your audit reports, and your technical agreements. Gaps in any of these areas trigger findings and often expand the scope of the entire inspection. And critically, supplier qualification is not a one-time activity. It must be maintained continuously through performance monitoring, periodic requalification, and formal response to quality events at the supplier. Before you begin qualifying any supplier, you first classify them by risk tier. The tier determines the depth and frequency of qualification effort required. Tier 1 is critical. These are suppliers of materials that directly contact the product or directly affect its quality, safety, or efficacy. APIs. Primary packaging materials such as vials, blister foil, and rubber stoppers. Contract manufacturers producing your finished dosage forms. Suppliers of culture media or reagents used in biological production. Contract testing laboratories performing release testing on your behalf. For Tier 1 suppliers, a mandatory on-site audit is required. A full questionnaire, full document review, and a visit to their facility. These suppliers are re-audited at least annually. Tier 2 is major. These suppliers indirectly affect product quality or support GMP operations. Excipients and processing aids. Secondary packaging materials. Cleaning and disinfecting agents used in GMP areas. Manufacturing equipment. Purified water system suppliers. For Tier 2, you complete a full questionnaire and document review. Whether you conduct an on-site audit depends on the outcome of your risk assessment, but it is strongly recommended. Re-audit every 2 to 3 years. Tier 3 is standard. These are suppliers of indirect materials or non-critical services. Non-GMP consumables. office supplies, non-critical lab equipment, training providers, facility maintenance contractors working in non-GMP areas. For Tier 3, a questionnaire and document review is sufficient. On-site audit is not routinely required. Requalification every 5 years is typical. The key principle is proportionality. Your most intensive qualification resources go where the risk to the patient and the product is highest. The qualification process follows 5 clear steps. Step 1 is risk classification. Before anything else, you assign the supplier to a risk tier as we just discussed. This determines everything that follows. Step 2 is the questionnaire. You send a formal supplier questionnaire. This is a structured document that collects information about the supplier's GMP status, regulatory certifications, quality management system, manufacturing processes, and key personnel. We will look at the questionnaire content in more detail on the next slide. Step 3 is document review. Based on the questionnaire responses, you request and review supporting documents. GMP certificates, ISO certifications, previous audit reports from other customers if available, relevant SOPs, and regulatory status information. This is the desk-based assessment that tells you whether to proceed to an on-site audit. Step 4 is the on-site audit for Tier 1 and Tier 2 suppliers. This is where you physically verify that the supplier operates in accordance with what they told you in the questionnaire. We will cover audit planning and execution in dedicated slides. Step 5 is the approval decision and registration. After completing the previous steps, QA makes a formal qualification decision and enters the outcome into the approved supplier list. We will cover the 3 possible outcomes shortly. The supplier questionnaire is your first formal interaction with a prospective supplier. Done well, it gives you the information you need to make a risk-based qualification decision. Done poorly, it gives you a false sense of assurance. There are 4 main sections every questionnaire should cover: company profile, legal name and all manufacturing sites covered by this relationship, ownership structure and any recent acquisitions, years in operation and key customer types, number of staff dedicated to quality and production, regulatory status, GMP certificate, which authority issued it, what scope it covers, and when it expires, FDA registration number if they supply to US regulated markets, ISO certifications relevant to your material type, such as ISO 9001, 17025, or 13485. And critically, whether there have been any warning letters, import alerts, or significant regulatory sanctions in the past 5 years. Quality system. Description of their quality management system. How often do they conduct internal audits, and what have recent findings shown? What is their CAPA closure time and their repeat finding rate? And importantly, what changes in their manufacturing process would trigger a customer notification, product and process information? What products are manufactured or tested at this site? An overview of the manufacturing process for your specific material. Whether any part of your order is subcontracted to a third party. And their capacity and realistic lead time for your material. A supplier who refuses to complete the questionnaire or provides consistently vague answers is already telling you something important. That is a red flag before you have even visited their site. For Tier 1 and many Tier 2 suppliers, the qualification process includes an on-site audit. Let me walk you through how to plan it effectively. A well-planned audit reveals far more than an unplanned one. Preparation is what separates a professional audit from a guided tour. The first planning step is to define the audit scope precisely and include it in your notification letter to the supplier. Be specific about which activities, products, and processes you will assess. A defined scope means you can return to it if the supplier tries to steer you away from areas of concern. Second, review all available information before you leave your desk. Read the questionnaire responses carefully. Review the previous audit report for the supplier if one exists. Check their COA history in your system. Verify their current GMP certificate status online through the regulatory authority's website. By the time you arrive, you should know more about their documented quality system than the average employee there. Third, build a tailored checklist. Base it on the relevant GMP regulations, your material specification requirements, and the specific risks you identified during the questionnaire review. Not a generic template. A checklist specific to this supplier and this material type. Fourth, confirm all logistics. Confirm the date, site address, key contacts, and start time in writing. Arrange access in advance to any controlled areas such as clean rooms, testing laboratories, and raw material storage. Ask whether you need specific PPE and bring your own. Fifth, assemble the right team. A lead auditor plus at least one technical specialist matched to the supplier type. If you are auditing a microbiological culture media supplier, bring a microbiologist. If you are auditing an analytical laboratory, bring an analytical chemist. Two people see more than one and can follow parallel trails simultaneously. During the audit itself, there are 4 critical areas to focus on regardless of what type of supplier you are visiting. Quality system documentation. Check whether SOPs are current, version controlled, and physically accessible to the staff who need them. Cross-check a batch record against the relevant SOP to see if what was documented matches what the procedure requires. Review the internal audit schedule and the most recent audit reports. Are findings being closed on time? Review CAPA records to assess whether root causes are being genuinely identified and whether CAPAs are being verified for effectiveness after closure. Facilities and equipment. Is the facility clean, well organized, and physically appropriate for the materials being produced or tested? Is equipment within its calibration and maintenance schedule? Are raw materials stored correctly and physically segregated from finished goods? Are there effective controls to prevent contamination and cross-contamination? Personnel and training. Are key personnel qualified for their roles? Ask to see CVs and training records for analysts performing critical tests or operators running critical manufacturing steps. Is GMP training current for all staff in regulated areas? Are there enough qualified people to handle the current workload without taking shortcuts under time pressure? And how is the company managing staff turnover in critical roles? Data integrity. This is increasingly the most important area of any audit. Are original records being retained and protected from alteration? Are audit trails enabled and actively reviewed on analytical instruments, balances, and the LIMS? Are individual user logins in use, with no shared credentials? Are paper records being completed contemporaneously, signed, and dated correctly? During the audit, take detailed notes. Record document titles and version numbers, equipment IDs, batch numbers, and analyst identifiers. The specificity of your notes determines the quality of your findings. After completing the questionnaire review and the audit, QA makes the formal qualification decision. There are 3 possible outcomes. Approved. This status is granted when there are no critical or major findings. Any minor findings have a documented CAPA plan with realistic timelines agreed by the supplier. The overall assessment is that the supplier demonstrates adequate GMP compliance for the intended supply. An approved supplier is added to the approved supplier list, a technical agreement is executed, a regular audit schedule is established, and COAs from this supplier may be accepted upon your standard verification review. Conditional. This status is granted when major findings are identified but they are not critical, and the supplier has submitted a credible CAPA plan with defined timelines. A risk assessment supports the decision to permit limited supply during the remediation period. The supplier is added to the list with a conditional status flag. Supply is only permitted for specific materials or in limited volumes. CAPAs must be closed before full approval is granted. COA monitoring is intensified during the conditional period. A follow-up audit must be conducted within 6 months to verify CAPA implementation. Based on that outcome, the status is either upgraded to approved or downgraded to rejected. Rejected. This status is given when critical findings are identified, when the supplier cannot provide adequate assurance of GMP compliance, or when there are fundamental quality system gaps that represent an unacceptable risk to your product quality. The supplier is not added to the approved supplier list. No GMP materials may be purchased from this supplier. The supplier must be notified formally in writing. Requalification is only possible after a minimum of 12 months and upon credible evidence of fundamental remediation, followed by a complete re-audit. Qualifying a supplier does not mean the work is done. Qualification is earned and it must be maintained over time. Supplier performance changes. Staff leave. Processes drift. Ownership changes. A supplier that was excellent 2 years ago may have serious quality problems today. Ongoing monitoring is how you stay informed and protect your supply chain before a problem reaches your product. Track supplier KPIs on a monthly basis. COA pass rate from incoming inspection. On-time delivery. Frequency of deviations or complaints related to this supplier. Response time when you notify them of a quality event. Plot these over time, not just month by month, to detect trends. Conduct COA trend analysis. If the same test parameter comes back consistently at or near the specification limit, that signals process drift at the supplier. Investigate it proactively before it becomes an OS result at your site. Review change notifications formally. Ensure all supplier changes are being notified per the requirements in your technical agreement. A missed notification is a compliance failure that must be raised as a deviation. Conduct periodic re-audits per your tier schedule. A re-audit is not a rubber stamp. It is your most powerful tool for verifying that the supplier's systems remain functional and that the quality you observed during initial qualification has been maintained. Respond formally to quality events. When a supplier-related deviation or OS result occurs at your site, notify the supplier formally and in writing. Track their response time and the quality of their investigation. This tells you a great deal about their quality culture. And define disqualification triggers in your SOP. What specific events require a supplier to be removed from the approved list? A critical finding in a re-audit. A regulatory warning letter. Failure to respond to quality events within the agreed timeframe. Multiple consecutive failures to meet specification. These triggers must be defined proactively, not discovered reactively. Let me tell you exactly what inspectors look for in your supplier qualification files, because this is where many quality teams are caught underprepared. The first question is whether you have a written, current approved supplier list. This must exist as a controlled document listing every GMP materials supplier with their qualification status, the date they were qualified, and the date of the next scheduled review. The second question is whether there is a complete qualification file for each approved supplier. Inspectors look for questionnaire responses, document review records, an audit report where required, the technical agreement, and ongoing performance records. All in one accessible file. The third question is how recent the last audit was for your critical suppliers. Inspectors will compare the audit date against your defined re-audit schedule. An overdue re-audit for a Tier 1 supplier is a major finding, regardless of how well that supplier performed in previous inspections. The fourth question is whether any Tier 1 suppliers have never been audited. For critical suppliers, no audit on record is a critical finding. The qualification cannot be considered valid without on-site verification. The fifth question is what happened when a supplier performed poorly. Inspectors look for evidence of formal notification to the supplier, investigation, and follow-up. Ignoring supplier performance events is a systemic quality gap. And the sixth question is whether all materials used in production are traceable to approved suppliers. Inspectors will sample material usage records and trace them back to the approved supplier list. Any material from an unapproved source used in GMP production is a critical finding with potentially very serious consequences. Let us bring the lecture together. 6 things to remember. Number 1. Your product quality starts at your supplier. EU GMP Chapter 7 and FDA 21 CFR 211 require all GMP materials to come from qualified suppliers only. There is no alternative. Number 2. Classify suppliers by risk tier before starting qualification. Tier 1 critical suppliers require mandatory on-site audits. The depth of qualification must be proportional to the risk. Number 3. Qualification follows 5 steps. Risk classification, questionnaire, document review, on-site audit where required, and formal QA approval with entry into the approved supplier register. Number 4. 3 qualification outcomes: approved, conditional, or rejected. Each has defined conditions, monitoring requirements, and review timelines. The decision must be formally documented and QA approved. Number 5. Qualification is ongoing. Track supplier KPIs monthly, analyze COA trends, conduct re-audits per schedule, and respond formally to every quality event involving a supplier. Number 6. Inspectors check the approved supplier list, individual qualification files, audit frequency, and material traceability. Every gap in these areas is a finding. That is Lecture 21 complete. Coming next in Lecture 22, we look at quality metrics in manufacturing environments. We covered lab KPIs in Lecture 16. This lecture focuses specifically on the production floor. Batch write first time rate, yield, line clearance compliance, rework rate, and the other metrics that manufacturing quality teams use to monitor their own performance. If this lecture helped you, please give it a like. Subscribe if you have not already. And drop your questions in the comments below. I read and replied to everyone. I will see you in Lecture 22.